In this section, we will be looking at the drugs used to treat angina. Angina is chest pain that occurs when the oxygen supply to the heart is not able to meet the oxygen demand of the heart. There is decreased oxygen supply to the heart because of decreased coronary flow, and this is due to the atherosclerotic plaque that causes narrowing of the coronary arteries. On the other hand, some factors can cause an increase in oxygen demand. For example, exercising would increase heart rate and contractility. And in stable angina, we know that the pain often occurs during exercise. One goal of the treatment of angina would be to reduce oxygen demand of the heart. And this would be by reducing the heart rate as well as contractility of the heart, reducing the afterload, which is the pressure that the heart needs to pump against, and reducing the preload, which is the amount of blood in the heart before the heart pumps. Another important goal of angina treatment would be to improve myocardial oxygen supply. One more important goal of angina treatment is to control the symptoms, which is to relieve chest pain and prevent angina attacks. People with angina also have a higher risk of getting a myocardial infarction, which is a heart attack. So it is also important to prevent the progression of this disease to a heart attack. The most common drugs used in the treatment of angina are nitrates, beta blockers, and calcium channel blockers. Among these, nitrates and calcium channel blockers work by dilating the blood vessels. Calcium channel blockers and beta blockers are cardiac depressants, which means they slow down the heart rate and decrease the force of contraction of the heart. Calcium channel blockers and beta blockers are used as first-line therapy in the treatment of angina, while nitrates are also important to relieve the symptoms of angina. Let's first look at nitrates, but first, some background. Nitric oxide is a molecule produced by many cells in the body, including endothelial cells in the blood vessels. It is also known as endothelium-derived relaxing factor. One of its functions is to relax vascular smooth muscle that causes vasodilation through the formation of cGMP. Nitrates are drugs that mimic the actions of endogenous nitric oxide by either releasing nitric oxide or forming nitric oxide within tissues, and thus they cause vasodilation. Vasodilation of the coronary arteries helps to improve blood supply to the heart. Vasodilation of the veins in the body increases the capacity of the veins to hold blood. Thus, it reduces preload, which is the amount of blood returning to the heart. Vasodilation of the arteries helps to reduce afterload, which is the resistance that the heart must pump against. Here are examples of nitrate drugs. Glyceryl trinitrate is also known as nitroglycerin. It is available in a sublingual form, so this is a tablet to be put under the tongue. This sublingual tablet is used for acute attack, so meaning only when the person experiences chest pain, they would put the tablet under the tongue. It is not meant to be used on a regular basis. Since the medicine is absorbed directly into the blood vessels under the tongue, it produces a rapid onset of effect, and it also doesn't need to be metabolized by the liver before entering the blood circulation, unlike oral drugs. Glyceryl trinitrate is also available as patches, which are applied on the skin, and this will give a sustained effect through the day. So for the patches, these are meant to be applied every day. Isosobate dinitrate, or ISDN for short, is a short-acting medication which is available in tablet form, and this will be taken 3 times a day. Isosobate mononitrate is a longer-acting drug which can be taken 1 to 2 times a day. If nitrates are given continuously, tolerance, which is also called tachyphylaxis, may occur. This means the medication suddenly becomes ineffective. To prevent this, the dosing schedule should allow for a nitrate-free period. For example, a patient who is using a nitroglycerin patch might wear it for 12 hours in the day and remove it for 12 hours at night to allow for a nitrate-free interval. Or a patient taking tablets might take one dose in the morning and a second dose in the afternoon, but not take it at night so that they have a nitrate-free interval at night. The side effects of nitrate are related to their mechanism of action. Since vasodilation can lower blood pressure, patients may experience orthostatic hypotension, which is a drop in blood pressure causing dizziness when rising from a sitting or lying position. This is also known as postural hypotension. Reflex tachycardia or fast heart rate may also occur, and this is a compensatory mechanism in response to the drop in blood pressure. The heart beats faster to try to increase blood pressure. Vasodilation also causes headache. This is due to dilation of blood vessels in the brain and flushing of the skin. This usually occurs at the start of therapy, and they will go away when the patient's body gets accustomed to the medication. Nitrates are often prescribed in combination with other medications. It is usually not suitable as a monotherapy because, firstly, a nitrate-free interval is required, so it does not provide a sustained effect throughout the day. And number two, other medications such as beta blockers can help to offset the side effect of reflex tachycardia. Patients on nitrate must be warned not to take drugs for erectile dysfunction such as sildenafil and vardenafil because nitrates increase the production of cGMP, and these drugs for erectile dysfunction inhibit the breakdown of cGMP. So these high levels of cGMP can then lead to severe and life-threatening hypotension. Next, let's look at beta blockers. We have already covered the mechanism of action of beta blockers for hypertension, and we know that beta blockers block beta receptors in the heart. This reduces heart rate, contractility of the heart, and reduces blood pressure. This is very useful in the treatment of angina because it reduces the workload of the heart and therefore decreases its oxygen demand. It is used as first-line therapy for the treatment of angina. So some examples, as you know, are propranolol, carvedilol, and atenolol. Finally, let's look at calcium channel blockers. We have also covered these drugs in the hypertension lesson. Calcium channel blockers block the entry of calcium into smooth muscle and cardiac cells. This causes peripheral vasodilation. Peripheral vasodilation reduces the preload and the afterload and therefore decreases the workload of the heart. Calcium channel blockers also cause coronary vasodilation, and this helps to improve blood supply to the heart muscles. These drugs also reduce the rate and force of cardiac contraction and therefore also reduces the workload of the heart. Calcium channel blockers are used as first-line agents in the treatment of angina. Examples of calcium channel blockers, as you already know, are the non-dihydropyridines, verapamil and diltiazem, as well as dihydropyridines such as amlodipine, felodipine, nifedipine, and nicardipine. As previously covered in the hypertension lesson, side effects of calcium channel blockers include bradycardia, which is slow heart rate, and vasodilatory effects such as edema, hypotension, and headache. After completing this section, you should be able to list the various classes of drugs used in angina. These are nitrates, beta blockers, and calcium channel blockers. You need to know the mechanism of action for each class, as well as the common drugs for each class. And you also need to know the common side effects as well as drug interactions for each class.